Dr. Vipin continues with the discussion and he says, Madam, what are the situations where RCT, root canal treatment, is not possible? Are there any situations like this? And
Definitely, sir.
what are the other options to save the tooth?
Okay, so there are many conditions where RCT is not at all possible. Like जैसे मैंने कहा कि अगर पेरिएपिकल पैथोलॉजी बहुत ज़्यादा फ्लेयर कर चुकी है and it has reached to the bone, then RCT is like can be done, but it is not a first choice. Like in a way, अगर वो space infection की तरफ पहुंच चुकी है, then RCT alone won't help it out. So this is a basic thing, and yes, that applies to every treatment, non-compliant patient. That is for sure. And if the patient doesn't want to save the tooth and you ask the patient to come twice, he's going to, he will land up in a situation where he will come with a buccal space infection or some other infection. So there definitely RCT is not advisable, but by and large there are no major contraindications or where RCT is not possible. The other condition being I know I should not say in this on this podium, but it's okay. Like, agar if I'm not good at, then definitely I'm not going to say RCT. That's another thing. So it's a patient factor and the doctor factors both work. And
And
yes, if the RCT
the
cannot,
communication also, because प्रोफेसर बटला, अगर आप कम्युनिकेट करें पेशेंट के साथ कि ये एक प्रोसीजर है, इसमें आपका दांत निकाल दिया जाएगा और एक ही प्रोसीजर चाहिए, फिर उसके बाद आपको आने की जरूरत नहीं, और ये दूसरा प्रोसीजर है जिसमें हम आपका दांत बचाने की कोशिश कर रहे हैं, बढ़िया बागबानी कर रहे हैं, जो जैसे जो माली है वो गुलशन का ख्याल रखता है वैसे हम करने की कोशिश कर रहे हैं, बट 5 बार आना पड़ेगा. So maybe that communication is something which is missing sometimes.
is missing. And sir, by and large, if I tell you my experience, it's not that it is my branch, that's why I'm advising it. So by and large, I've never seen a patient who doesn't wants to save the natural tooth. It's by and large they all want to save it, and that's why I think my field is working out. My field just says that you need to save the tooth. By saving the gums and the alveolar bone, I can save the tooth. So पेशेंट्स मोस्टली सर हमेशा दांत बचाने के लिए अपना नेचुरल दांत बचाने, एंड व्हाट आई से सर इट्स समथिंग लाइक अपना हाथ है प्रोस्थेटिक, arm or leg is artificial. What beautifully I may do implants, but the thing is the natural is a natural, so you always want to save the tooth, and patient by and large also wants to save the natural at any cost. They want to sometimes save, even in when we say no, it's a grade 3 mobility cannot be saved, नहीं डॉक्टर साहब बचा दो. So there we have other options, like we go for splinting, and but then we tell the patient that the prognosis is poor, we are splinting it at your will, but sooner or later it will be, it needs to be extracted. So you need to be very clear with the patient that अभी कर रहे हैं but इसको by and large निकालना पड़ेगा. एंड सर जो दूसरी चीज आपने पूछी कि अगर आरसीटी नहीं तो क्या ऑप्शन हो सकता है, अगर आरसीटी नहीं है तो सर अगर सेव हो ही नहीं सकता टूथ, एंड देन वी नीड टू एक्सट्रैक्ट इट and place the implant. We can go for an immediate implant placement, but with the condition कि नीचे पैथोलॉजी नहीं होनी चाहिए. जैसे आप सर कह रहे हैं ना कि नीचे जड़ से निकालना है, पर नीचे की वो जो धरती है या जो सॉइल है वो इतना तो होनी चाहिए ना कि दूसरा प्लांट ले सके. So that the alveolar bone should be without any infection. So there we can go for immediate implant placement on the very first day, with all the conditions and the factors we need to take care of it.